Ready?
Hey now, that's not how you pick up your keys. Have you heard of spinal hygiene?
Spinal hygiene? What's that?
Spinal hygiene is simply taking good care of the health of your spine through movement, exercises, and habits. So spinal hygiene is important because just like we take care of our teeth by brushing and flossing every day, right? Also, we need to take care of our spine. So we're going to talk about the brushing and flossing equivalents of our spine. So, in order to keep your spine healthy and keep you feeling well, there are three main concepts we want to focus on. So first, the spine should be straight from a front view and have natural curves from the side. Any anatomy book should have an image of the spine in its proper alignment. Two, the spine should be able to move fully through its range of motion. The spine should move symmetrically and fully through all three planes of motion. Three, the muscles around the spine and the postural core muscles are a vital part of spinal health. These muscles should be balanced and strong.
First, we're going to talk about some daily practices that you can incorporate into your routine to improve your spinal hygiene. The first thing that we're going to talk about is sitting. So as you can see, Tim is slouched over, his back is rounded, and his hips are tucked under him. In order to correct his sitting posture, we are going to have Tim sit as if he has a tail that he doesn't want to sit on, and rock his pelvis forward. Just by doing that, you see how the spine goes from a C curve into a J curve. Also, it's really important that when you have to sit for extended periods of time, you stand and take breaks to give your spine a rest. Next, we're going to talk about lifting. First, it's always better to push something rather than pull it. And if you need to lift something, it's always better to bend at your knees, close to the object, and pick it up, and avoid twisting your back as you lift the object. Good job, Tim.
Thanks. Sleeping is also another very important aspect of spinal hygiene. As you can see, Virginia here is sleeping on her side with her legs stacked, and she has enough pillow cushion on her head to make sure her head isn't going down, putting more compression on her cervical spine. And you always want to, if at all possible, to sleep with a pillow between your legs to prevent your hips from twisting and turning in the middle of the night, creating more torque and tension on your lumbar spine.
A few other aspects of spinal hygiene to consider involve your phone and your backpack. So when you're talking on the phone, you don't want to pinch the phone on your shoulder up to your ear, as this creates tension on the side of your neck. Instead, hold the phone with your hand and then straighten out your neck so that your neck is straight and healthy. Also, when you're texting, you don't want to be looking straight down at the phone, as this creates tension on the back of your neck. And so instead, straighten out your neck and put the phone in front of you and proceed. Also, with backpacks, you don't want to put one strap on and hold it that way, as that creates uneven weight distribution on your spine. So instead, put both straps on your backpack, and then the weight is evenly distributed.
So movement and stretching is also another key aspect into spinal hygiene. Today we're going to go over some neck exercises to help with the cervical spine and the hygiene and health of that aspect of your spine. Sam here is going to demonstrate some flexion and extension, and then some rotation, so right to left. And it's also important to do a chin tuck. What we're doing here is we're creating movement in the cervical spine throughout the day. A lot of times we're stuck in one position. Our joints and vertebrae just kind of get stuck and they don't really move. We know in today's day and age that movement is key to health. Also, with those exercises and those movements, we can also add a stretch to those. So we have flexion, bringing your chin down to your chest. You'll feel a nice stretch in the back of your spine, all the way down between your shoulder blades. We can also do lateral bending to the side, lateral stretch. You'll feel all the muscles in the side of your neck. Feel a pretty good stretch there. And then what we can also do is add just a slight rotational aspect to that stretch, chin straight down, you'll get a little more of the side and back of your neck. It's important to do these exercises, the stretches, because a lot of the tension headaches that we have, a lot of the cervical issues we have, are those muscles that directly attach to your skull and your cervical spine pulling down. So if we can stretch those out, elongate them, we can help a lot with spinal hygiene and tension headaches. So some important exercise and stretches we can do to help strengthen and loosen up the rest of our spine, the thoracics and lumbars. We can start off with some flexion and extension. Again, we're creating movement in our spine. We can also do lateral bend, right to left, and rotation. What we can also do is, especially if you work in an office job, you're sitting down every day, what we tend to do is we just kind of lock up our lumbar vertebra by just sitting in one position all day. An easy, simple exercise you can do is a pelvic tilt. Simply rocking your hips forward, rocking your hips backwards. What we're doing is we're just creating movement, getting more circulation, more blood flow to those discs in your spine, allowing them to be healthier over time. Another exercise that we can do that's similar to the pelvic tilts, but more specific to the thoracic section of our spine, is a cat-cow. So we're simply rounding out our back and bringing our stomach in forward. What we're doing is we're creating movement again in that spine, getting more fluid, more circulation to those discs. Another exercise that'll both create movement but will also strengthen some important muscles that support our lumbar spine is a modified Superman exercise. We're doing an opposite arm, opposite leg movement, contracting our glutes and also our erector spinae, our lower back muscles. We're strengthening our glutes, our erector spinae. A lot of those muscles directly support our lumbar vertebra and are used quite often in everyday office settings. And the last exercise, more of a stretch, is a cobra. So what we're doing here is we're trying to stretch out our psoas muscles, our hip flexors, muscles that directly attach to our lumbar vertebra and are often very tight in everyday life through sitting and being in a flexed position. So we can stretch those out and also try to reverse the straight curve that we often put in our lumbar spine through sitting every day. We can drastically increase our lumbar spinal health.
So these habits and exercises are excellent to do every day as a preventative measure to keep your spine healthy, rather than simply waiting till you have pain and going to the doctor to seek relief.